Ladies and gentlemen, this is an article that came out in the Carney Hub, May 12th, 2018. Opioid plague hits rural America hard too. Now, as you know, since Trump came out and put his opioid commission together and declared this a public health issue opposed to making it a national emergency, very little to nothing has been done. Now, many people are complaining about that, believe it or not. It is just that it's not getting a lot of publicity. Despite much talk by Trump and many others, relatively little has been done to date to combat the plague, which continues to grow. This is a problem for all parts of the nation, including rural areas. A May 1st report in the Journal of the American Medical Association states drug overdose deaths are at unprecedented levels in the United States. According to the National Safety Council, 63,632 Americans died of drug overdoses in 2016. Over 42,000 of those deaths, about 2/3, were due to opioids. The council recently published a white paper titled Prescription Nation 2018. In it, Deborah A.P. Hirschman, president and CEO of the National Safety Council, said, "Our nation is confronting the most fatal drug plague in U.S. history." The paper is available for download from www.nsc.org. The opioid plague and drug dependency in general is a nationwide problem. Too many people think of it as an inner city or urban issue and treat it as such. First of all, the opioid plague has never been an inner city or urban problem. And those of you that believe that, you just choose to believe that. However, rural America has been hit especially hard by the drug plague, and dealing with the crisis can be significantly harder in rural areas due to largely to the lack of available treatment options. For many living in rural areas, the nearest treatment center for addiction is a 2 or 3 hour drive away. Well, I mean, whose fault is that? You choose to live in those remote areas. That's what happens. That means you are far away from a lot of things. The expense of such a trip, including time away from work and possibly the need to pay for childcare, may be financially untenable. Treatment may prove to be out of reach. Indeed, the lack of local health care may be not only hindering treatment, but contributing to the problem as well. For many, prescription pills lead to addiction when other options for pain management, like physical therapy, are not available. Another impediment to treatment may be the view of many of drug addiction is some sort of moral failing. Fear of being judged and condemned by family and friends can keep addicts from reaching out to the support system they need. Recovering from opioid dependence is not simply a matter of getting clean. It can take months or even years to recover from the bodily change caused by opioid abuse. The cravings can crop up again long after addiction has stopped, the addict has stopped using. And that is the reason, ladies and gentlemen, why they fall off the wagon almost immediately after getting out of rehab, because as soon as they're out, they're craving the drug and they're running right back to the drug dealer. It's more common than uncommon. That is why many recovering addicts can fall off the wagon, even if they have been clean for years. Therefore, ongoing treatment and therapy is essential. The National Safety Council has prescribed 6 key actions states should take to combat the crisis. Number 1, mandating prescriber education. Number 2, implementing opioid prescribing guidelines. Number 3, integrating prescription drug monitoring programs into clinical settings. Number 4, improving data collection and sharing. Number 5, treating opioid overdose. Number 6, increasing availability of opioid use disorder treatment. To date, only Nevada and New Mexico have taken all 6 actions. 10 states plus the District of Columbia have taken 5 of the key actions. Arizona, Connecticut, Delaware, Georgia, Michigan, New Hampshire, North Carolina, Ohio, Rhode Island, and Virginia. Gordon Hopkins is an award-winning columnist and feature writer for the Fairbury Journal News. Prior to that, he worked for several years in the health insurance industry. His latest book, Nebraska at War, Dispatches from the Home Front and the Home Front Lines. All right, so as you can see, many of the people in the rural areas that have a drug addiction problem, they're not even bothering to go out here and get help at all. So, hey, tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. If you have an Android device, please go out and get my app. Hopefully the iOS version of it will be out shortly. I sure hope so. And if you can support my channel, please do. Peace, family.